How critical is this? The operations that you will do for these patients.
Well, we have patients from legal blindness to patients who have problems with their daily activity, consistent with the level of their vision being poor. That meaning can't drive at night, can't function at their computers, and basically it in handicapping them in functionality.
I'm Dr. Giovanni Greaves, and I work with PIH in Southern California.
What is PIH?
PIH actually stands for Presbyterian Intercommunity Health, but it goes by PIH now, so we don't actually use the actual full term.
Okay. And you, sir?
I'm Basil Morgan, and I am here in independent capacity, but I am assistant professor of ophthalmology at the Johns Hopkins Gleaner Eye Institute, and I'm here on this mission as an
Okay.
independent.
So, what is this mission? I understand that you are about to do surgery for patients, outpatients rather, who have been waiting for at least a year.
Well, I'm not sure exactly the length of time they have been waiting, but because of the non-functional status of the hospital, there's been a backlog of surgery and eye care. We're part of a team. There are 23 of us down here, and they're fanning out in satellite clinics to do screening, refraction, that is mean examining patient for glasses and actually manufacture and give them the glasses. We are the surgical side, as we are doing uh, cataracts, we're managing glaucoma surgery, and we're doing pterygium, which is that fleshy growth that goes across the eye.
Okay. And how long will you be here? How many patients will you operate on during the period that you're here?
So we'll be here for approximately 4 to 5 days, and I think in terms of the number of patients, I think anywhere from 50 to 65.
Yes, that's a guesstimate because it depends on the OR flow. But there's no shortage of patients. What we have is shortage of facilities to accommodate them at the moment.
So you're in a makeshift unit.
Right. What the concept was with the hospital in a issue with inability to provide this kind of care, University of Michigan Engineering Department came up with a brilliant idea of repurposing shipping containers. And so what they've done is created a complete operating theater using refurbished shipping containers with solar panels and an OR and facility. It's a wonderful concept. And if this works here, it can be pushed out in different areas because it can be moved. Yeah, so
Yes.
the concept was to create a pod that is mobile, yet at state of the art facilities. The beauty about it is self contained, it's powered by solar collectors, humidity contained, and it can be moved. All you need is a flat area to put it down.
How
So,
many surgeries then are you going to be able to do each day?
well, we have two operating room theaters here. If both were operational, we would run about 30 patients. Today, our manifest says we'll be doing about 13 patients today.
How critical is this? The operations that you will do for these patients. What difference will it make in their lives? How serious are their conditions?
Well, we have patients from legal blindness to patients who have problems with their daily activity, consistent with the level of their vision being poor. That meaning can't drive at night, can't function at their computers, and basically it in handicapping them in functionality. So we're trying to improve their daily life, and this service is being given free.
Do you have any idea how much this would cost if they had to pay though?
Well, I only know American
US
price.
dollars,
Okay,
that's fine.
the anesthesia bill, the average cost would be somewhere north of 3,500 to 5,000 US dollars per case per eye.
Have the doctors told you what it is that's wrong with your eyes?
Says cataract.
Cataract.
Yeah.
And how long have you had this condition?
Well, back, it would be about 3 years ago.
3 years. But you weren't able to get the surgery done?
COVID coming in, yeah. But,
Okay, so during COVID
Yeah.
and after COVID.
Yeah.
So how do you feel about the fact that you're gonna be operated on today?
well, I just trust in God. And
Oh,
say,
you're trusting God.
yeah, I say everything will go.
How has the cataract affected your ability to see?
Very only dark.
It's dark.
Yeah.
Have you been able to drive?
Not very retired now.
You retired. What is the condition that you are having? Why you need to have surgery?
Well, I'm not seeing right now out of this because right now I'm talking to you. The whole place is glassy.
Okay.
It's glassy. Yeah, like you're looking through a glass. That's how it look. That's how it look right now.
Right.
And right in front of me, you see some little dots of blood. Some little dots. That's of blood
In the back of your eye?
moving around in front of me right now.
Oh, okay.
Yeah, moving in front of me. Some little dots. That here and there.
Okay. So you're not seeing anything well.
Not no.
Okay. And you were saying that they found that there was blood in the back of at the back of your eye?
Yes. The last screening I got, the doctor said the cataract in the both eyes.
Yes.
And so on. The doctor says, well, when she do this screening that time, she said there was no bleeding. There was no bleeding at that time, but scars. It says scars in the eye. So like maybe dry up blood or something.
So it seemed like it was bleeding before?
Yes. So
Okay.
what she says is that if we do the surgery and move the cataract, and so maybe we have to do laser surgery to remove the scars. That's what
Okay.
she was saying.
I'm Dr. Winsome Leslie.
Dr. Leslie, your husband is Dr. Morgan,
Correct.
and you're part of a team that has come to Jamaica this week to ensure that some of our people are able to see better. How is it that you were able to afford to do this? Where did you get the funding?
Well, first of all, we're affiliated with the Eye Health Institute in Michigan, and they've been coming to Jamaica to do volunteer work, primarily in optometry, for the last couple of years. So they are a non-profit, so they get donations. Specifically for this trip, Dr. Morgan has a relationship with several pharmaceutical companies in the States, and they supply product for free for his missions both here and elsewhere in Africa and Kenya and Ghana and so forth. In terms of our own expenses, we're covering those ourselves.
Airfare, accommodation, food.
Exactly, because we see this as a way of giving back to Jamaica. We're all Jamaicans, so.
Do you go to other countries to do this, or you're here giving back to your country?
Well, it's twofold. My answer is yes. I'm a yes on both count. I've done it successfully in this country at least 4 times before. But internationally, I've been to Ghana, Nigeria, I've been to Kenya, and and other places to do something similar on a medical mission.
Yeah, so so I'm originally from Jamaica, but this is my giving back for the first time actually, so I'm really happy to be here.
Do you know what the success stories have been like for the surgeries?
Where? Which country?
The ones that you have done in Jamaica.
Oh, well, I want to give you an encounter.
Yes, please.
We had a patient in Maypen once, and we did her surgery in Kingston and a mission. And she told the nurse he could not see, man of vitality, in his early 40s, and he heard the nurse talking, and he said, "Honey, if I can see after the surgery, I am going to find you." The day after they pulled the patch off, just from the voice recognition, he found her and laid a big hug and kiss on her. So, and it changed his life.
So he was able to see.
Yes, oh yeah, I was absolutely able to see. We aim for, at the end of the surgery, the patient to see, be able to drive without glasses. They may need a pair of reading glasses to read the very fine print, but we're aimed for passage of driving license. without glasses.
Is there any laser treatment or anything like that that you use, or?
Well, I mean, we're doing standard cataract surgery, so we won't be using any laser, but and for most cases, actually, you don't have to use laser-based cataract surgery. You can do it manually and achieve similar outcomes in terms of being able to see well without glasses. So,
Laser surgery, and be careful when you use the word laser,
yeah.
because laser surgery in a procedure, it only does a part of the procedure. You still have to manually do things. Okay,
So it's laser assisted, not laser
laser
surgery.
surgery,
Right,
laser
right.
assisted,
Yeah.
and actually the outcome is no different
Right.
statistically whether you do it by laser or manually. And that's why most insurance companies in the United States will only pay for the manual. Anything extra, you'll have to pay out of your pocket.
So there are 20, how many of you here? 27?
23.
23. Are these all doctors?
No, there's supports. It's there's support and there are doctors. Now, just to be definitionally correct, there are two types of doctors here. There are doctors of optometrists. They are not a medical doctor. They prescribe glasses, do the refraction, do contact lenses, check pressures, and in certain instances can give certain medication that are authorized for them to hand out. We are actually physicians, ophthalmologists. And ophthalmologists are physicians who specialize in eye care, eye surgery.